let's talk about that third shot. When should you get that third shot? Are you willing to get that third shot? Should you get one? Joining us live now is our COVID expert from UCSF, Dr. Peter Ching Han. Thank you, Dr. Peter, for being with us. Okay.
My pleasure, Jess. Thanks for having me on.
I have to start by asking, is it in our best interest to start giving out third shots when we still have a bunch of people who have not even gotten the first shot, some of them by choice, some of them are children who can't get that first shot? So we're kind of re-immunizing the people who are already basically protected.
Yes, exactly. So that exact point is debatable. I would say that from the science, we know that most of the hospitalizations and serious cases and deaths are overwhelmingly unvaccinated. But I think the seminal data is coming from Israel, and it's showing that there's an uptick in hospitalizations in vaccinated seniors. And I think that's what's driving the Biden administration to recommend boosters in most Americans, although the lowest hanging fruit is of course, our nursing home population.
Okay, well, Dr. Peter, part of the reason that a lot of the unvaccinated say they don't want the shot is because they say that the medical landscape keeps changing. Originally, experts came out and said, no, you're not going to need a booster shot. And now all of a sudden it's like, you're going to need a booster shot, and you need it 8 months after you got that last vaccine.
Yes, exactly. I can't blame people for feeling weird about changing recommendations. But the other way to reframe that is to think about the fact that our government, our public health leaders are really responsive to science. Science is dynamic. And in COVID, as everyone knows, there are new findings every day. We have to be humble about this virus. We have to be humble about this infection and respond to changing science.
Right. So you're saying that as we learn more, then we learn something new and how to respond to that. So how much extra protection will this booster provide? And now, if I get the booster shot this time, does that mean then a year or 8 months from now, I might have to get another booster shot? I mean, is this going to be an endless, lineup of booster shots?
I think that's what a lot of people are fearing. But if you look at other vaccines that we commonly use in medicine, hepatitis B, the HPV vaccine, measles, mumps, and rubella, they're all 3 series shots. Every time you get a third shot, another shot, you increase the time of protection. That's why, in general, 3 shots of a hepatitis B virus can take you on to the finish line. That is, your lifespan. Whether or not we need another booster eventually will all depend on variants. And coming back to your original point, I personally think it's more important to vaccinate most people with at least 2 vaccines around the world than to immunize some folks with 5 or 4 or 3 vaccines. But if we have the vaccines, it's going to give us additional protection.
Yeah, that's a really great point. Like with kids, you have to give them that meningococcal. The teenagers, you get them a series of 3, so that makes sense. Very, very quickly, what happens to the people who took the J&J? I mean, because they're saying get that third shot for the, Moderna and Pfizer, but where are we leaving the people that got the J&J vaccine?
Yeah, so that's where there's a dissonance or a disconnect between clinical judgment and what the science is. There is little science because not as many people got J&J. We're getting most of our early data from Israel because they've immunized their population before us. They didn't use J&J, they used Pfizer. The UK didn't use J&J. So we're waiting on our own local data. So far, it suggests that at the minimum, J&J is like the others. So if we're saying the others need a booster, of course the J&J folks will need a booster too. The data, or some data, will come at the end of this month when the manufacturers are going to study the effects of 2 J&J vaccines on safety and efficacy.
All right, Dr. Peter, thank you very much. As always, you are a wealth of knowledge for us, and you keep us calm, which we really appreciate during this pandemic. Thank you.